Hi, I'm Dr. James Boone, addiction medicine and internal medicine doc. I've worked here at La Hacienda for the past 17 years. And I want to talk a little bit about prescription drug abuse. So prescription drug abuse is a broad category. And the medications that are involved in prescription drug abuse all have a commonality. And that commonality is that they also work in our reward pathway. And that's the part of our brain that we experience pleasure, reward, but that's also where the classic drugs of addiction that you might think of, like heroin or cocaine or methamphetamine, very potently stimulate that reward pathway. So these prescription medications that have good indications that doctors prescribe for different conditions that have that potential for abuse work in that reward pathway. We talk about prescription drug abuse. Really, there are several different categories of medications that are the main ones that we see. One would be the group of pain medications that are typically in the opiate class. So those are medicines like hydrocodone or Tylenol with codeine, the more potent pain medicines like oxycodone, maybe after surgery or surgical procedure, and then the very powerful pain medication fentanyl that's mainly used for cancer patients. But that group of pain medications that is designed for pain in my brain also has a crossover and works in that reward pathway, which is what gives that drug abuse potential. The next big group of medications in the prescription class that are abused are the benzodiazepine family of medicines. Those are medicines that were designed for short-term use of severe anxiety symptoms, and they're highly effective for that, but they also work quite intensely on that reward pathway, which give them a high potential for abuse or addiction. That medication that probably is the most popular one now that we see here at La Hacienda so often would be Xanax or alprazolam, but also Klonopin or clonazepam, another medicine. For some of the older viewers, maybe diazepam or Valium, benzodiazepine. So that family of medicines which can be highly beneficial for short-term anxiety, but unfortunately have high risk of addictive potential. Similar to that benzodiazepine family would be the sleeping medicines, the sleeping pills. And some of those sleeping pills are in the benzodiazepine class. Probably Restoril or temazepam might be the best known. But non-benzodiazepine sleeping medicines that were initially thought to be safe or to not have abuse potential have later been shown to be very problematic. So at La Hacienda, we take care of a lot of patients who struggle with Ambien and some other sleeping pills like Lunesta or Belsomra. Those medications also have abuse potential or addictive potential. Lastly would be the stimulants, and the stimulants are most commonly used for attention deficit disorder, for focus or for wakefulness. So the medication that we probably see the highest abuse of here would be maybe Adderall, that most of you are familiar with. Adderall is actually a mixture of methamphetamine and amphetamine salts, so it makes sense that it works in the reward pathway pretty intensely. But also all of those drugs used for attention deficit disorder, medicines like Ritalin or Daytrana or Vyvanse or Focalin, those medications all have that abuse potential because they also work in the reward pathway. The stimulants are also used for weight loss. So medicines like phentermine or methylphenidate, from a dietary standpoint, those medications work in that pathway. From a prescription drug abuse, I really see two categories of people that struggle. One may be somebody that everybody recognizes already having addiction issues, somebody that's already struggling with alcohol abuse or with cocaine or heroin or methamphetamine. But if they have access to those prescription drugs that work in the same way, then that's a drug that they can readily seek out. So those of you that might have those prescriptions, for example, I had knee replacement a few years ago and I had some pain medication. I had a bottle of 20, I took 7 before I threw those 13 tablets away if that was sitting in my medicine counter and I had a son or a daughter or a friend that came over to the house. That's a thing that you certainly want to lock up or destroy if you're not using to let that person not have access. So we see those people that either start to seek out those prescription drugs, either from friends or family members, and can then end up abusing those prescription drugs or even buying them off the street. So that's one category. And then the second category of people that struggle with prescription drugs are people that really did not see themselves as having any issue with addiction. So let me just give you an example. Let's have a middle-aged guy, maybe early 40s. He was a pretty heavy drinker in college, but did well, highly functional, married and works a full-time job, has been productive at work, starting to drink a little bit more at night to try to help sleep. and still having some increased sleep issues. Still nobody really recognizes alcohol as a problem, sees his doctor, says, I'm just really struggling with sleep. The doctor prescribes Ambien, and he takes Ambien, and not only does he sleep well, but he notices that right when he takes the Ambien, that there's also something inside that feels better. Less anxious, less emotional distress, and something about that he likes. And he takes it as prescribed for a period of time, and then potentially a rough day, he gets home, he's stressed, his wife has already been upset about the drinking, and he decides to take a half an Ambien in the daytime. And it feels good. And he starts to take that more often. He then is a little bit impaired. He's combined some Ambien with some alcohol. He has a fall. He hurts his arm. He has a broken elbow. He has to have surgery. He gets a prescription for pain medicine. And then the pain medicine makes him feel good. It's something different. For me, with no risks of addiction, I got some pain medication, as I mentioned, after my knee replacement. Nothing that I like in that. But that person that might have genetic risk for addiction or some childhood trauma or adolescence, they get exposed to that same chemical, and that effect in their reward pathway is more prominent. And there's this sense of euphoria. Again, there's less emotional pain. There's something more, and he takes it as prescribed initially for his elbow, but then that also helps. And now he's trying to get an extra refill, and now he's getting more, and then he goes to see a different doctor, and now he's taking hydrocodone and Ambien. But now he's a little bit sleepy in the day, and he has a friend who has Adderall, and he takes his friend's Adderall, and then he takes a little test online and says, I think I have attention deficit disorder. And he sees the doctor, and then they prescribe Adderall. And you can see how this can develop, and this person that really didn't see themselves as having any issue, 6 months later, a year and a half later, their life is falling apart. So from a prescription drug standpoint, any of those medications that are controlled by the FDA, they're controlled because there is a danger with those medications. They all have their own set of risks, but also when you combine them, that effect can be more than additive, synergistic, like 2 + 2 = 9. So we know, for example, with multiple accidental opioid deaths, where people accidentally die with opioids because they put their respiratory drive, their breathing pathways to sleep, almost half of those people also have benzodiazepines on board. So they've taken some Xanax or some Klonopin. So the prescription drug category is this kind of broad group of chemicals that can interact in different and dangerous ways. It's a problem that we see all the time. It's something that if you are struggling in that category, something that you need to get help with. We would love to be a part of that, or we'd love to guide you in a different pathway. However we can be of help, know that we're here. Thanks.